All right. So it is 2 p.m. Eastern Time here. Thank you, everyone, for joining us today on our ThirdEye Crozer Health webinar with our special guest, Chief Egan. My name is Ari Candelier. I am the Director of Support here at ThirdEye Gen. A few other members of our team will be talking on the panel. I want to introduce Jonathan Lucas, who is part of our healthcare partnerships here at ThirdEye. On this call as well, we have our CEO and founder, Nick Cherukuri, um, as well as Noah and other members of our support team. Again, Chief Egan is our special guest today. Thank you so much. I know with the calls coming in and out, hopefully we can do this more direct here. And thank you, Tim. Just want to give everyone here, our audience, on your lower left-hand side of this conference, feel free to enter any questions. We'll have a Q&A at the end of the webinar, but please feel free to ask any questions. Lower left-hand side, there is a chat button first to the left that you can use. I would also like to quickly shout out a few of our audience members. Global, we've got Sim Technology out of Beijing joined us on this webinar. We've got Orange out of France, a huge telecom company out of France, as well as Verizon and some other telecom partners that have joined us today. So welcome, as well as Brazil, clients from Brazil as well. So thank you so much for joining us on this webinar. Chief Egan, how are you feeling today, sir? How was your day so far?
So far, so good. Thank you for having me.
Thank you so much, sir, for your time. Tim, whenever you're ready, we can get over to the next slide.
Sure.
So I'll pass it over to our CEO, Nick Cherukuri, to talk a little bit about our company, ThirdEye. Nick?
Thank you, Ari, for the background, and thank you once again to Chief Egan for all the work you do in the first responder space. We really appreciate it. So just some background about ThirdEye, who we are, what we do, and why we came into this space. We've been a leader in the AR, MR space for over 20 years. We've been developing this technology for the U.S. Department of Defense. This is our X2 glasses. We're coming out with our next generation of glasses very soon. We have about 200 plus employees worldwide who do a variety of different high-tech technologies. And one of our advisors, I think Congressman Kurt Weldon, who is on this call, has been one of the leaders in the government space for first responders for his entire career. And we've been really looking to see, especially with COVID and everything that's been going on over the past year and a half, unfortunately, how we could use augmented reality to benefit first responders. And we really honed down on some telehealth features, and that's something our team will talk about a lot more in this call. And thankfully, working with Chief Egan, we were able to develop a pretty sophisticated application for first responders. And our team has a lot of experience in this space. They have many patents in the AR, MR space, as well as in the software space. And we're really trying to use our expertise to help first responders out this year. So thank you, Ari, and thank you, Chief Egan, for joining.
Thank you so much, Nick, for that introduction. Tim, we can move over to, yes. And then our special guest, again, Chief Egan here with us today, Chief of EMS for Crozer Keystone Health System, over 100 staff members under your leadership, receiving 35,000 plus calls a year, with 14 units running 24 hours with your guidance, daily leadership. Again, a huge instrumental piece of this platform and how we tailored it to you, your team, and what you guys needed. Anything I missed there with that introduction, Chief Egan?
No, Ari, you took the words right out of my mouth. So no, but thank you very much. Great introduction, and again, happy to be here.
Thank you so much, sir, for your time. So you know, what is the X2 mixed reality headset, which we've deployed here with Chief Egan and his team? I've got a headset here that is being currently used here on site with a thermo camera built in up top. But this is the X2 mixed reality headset, essentially, that we have launched. It's very light on the head. It's Android-based, so it's been a blessing in terms of development. We're using a Qualcomm processor, so you have that strength built into the headset. You've got other features. There's a flashlight, voice commands, hand gestures, multiple ways of navigating the headset. Chief, what's been your experience using the headset?
Guys, for us, it's been the great lightweight feature, easy to use. The buttons are really easy to use. When you speak to the glasses, when you speak out loud, it hears you. So, and the communication has been great too. So all positive for us.
Thank you so much, sir. And again, with the training process, getting the team on board, how has that experience been with you, with your paramedics? You have a pretty big team, the supervisors here that I've had the privilege of talking to and getting to know. How has their experience been so far with the headset?
At first, definitely, as you could imagine, it was foreign to us. So something like this was, definitely something that we weren't used to. They're obviously start seeing the benefits and starting to come around as we do more and more training. I think it'll get just better. So so far so good on our end. Again, in the beginning, it was kind of a lot of questions from our perspective on how it can benefit us. But as we started to practice with it a little bit more, it definitely you could start to see its benefit real fast.
Thank you so much, and we're excited to continue on with the introduction. Obviously, with your assistance, moving it ahead. So thank you so much for all the help and the insight that you've provided with getting the headset launch here within your team. Tim?
My pleasure.
Thank you, sir. So we're here. We just want to talk about the challenge, Chief, that you've seen. Before ThirdEye was introduced, some of the challenges that you saw, and then I want to invite Jonathan on here to provide some of the solution analysis that you've done in order to introduce to Chief Egan and his team here at Crozer. Chief, I'll leave it to you.
Sure. The challenge from our perspective was actually being able to discuss with the patient condition in the field with the medical command doctor back at our emergency room. So what we were doing in the past was, a long time ago, we would have to use a landline, and then it morphed into using a cell phone to call the doctor. And now with this type of technology, we're able to use the RespondEye platform or the glasses and be able to actually have a doctor be at our fingertips to be able to see what's going on, to be involved in those complex cases that we often find ourselves in a pre-hospital setting. And the physician can give real-time feedback to the patient and to the providers. And we found that to be an invaluable asset. So that's where we've been focusing on for our integration phase. And we look forward to grow this and hopefully it becomes second nature for all of our providers. So that's where we are as far as our challenge and solution goes. We use the RespondEye platform and the glasses as part of a solution to a communication challenge or issue, and so far it's been working out great.
Thank you, Chief. Yeah, so just go over just a background, sort of the challenge and problem, and just the thought process behind developing all this. So emergency rooms, ICUs, just EMS, any scarce public resources or utility that's used for public good in the term realm of first responders is just limited. It's scarce. There isn't enough to go around. So instead of adding more people or more units or more inventory, it's how do you increase the marginal efficiency of your existing staff? So like Nick said, like Ari said, the company's been around for years, a strong, successful history. And now we can take this, what is still relatively new technology, and integrate it for a very specific and very viable use case with first responders. Chief Egan can give you far more detail about this, but from our discussions with him and just what we've seen in the field, there is a significant number of unnecessary ER visits in terms of a patient calls an ambulance, the ambulance shows up, no one is there, or the patient calls and they say they have something going on with them, but in reality, it might not be as severe. So the solution component for ThirdEye and RespondEye in general with the glasses is just imagine a hands-free way of being able to see exactly what the first responder sees, except from the vantage point of a remote physician. And obviously with AR tech, and as we continue the Crozer integration, as we expand, as we get more feedback from people who've been doing this for decades, then we say, okay, what other data do you want to see inside the glasses? Like what other critical information, patient information, vitals, whatever it is, we can put that in the glasses. And going forward, it's just the perfect hands-free solution for just giving insights to people who need it most, and ultimately just improving patient care. So Tim, if you want to go to the YouTube link, we'll put the video on silent, but I'll just give you a quick high-level walkthrough of just sort of what's going on in the video relative to the RespondEye platform.
There's a certain strain of bacteria called
So you can see here sort of, this could be a firefighter, EMS, police officer, just being able to see what the patient actually needs. The ability for a heads-up display, the ability to display data within the realm of the vision of the first responder. So here we're just showing vital information, whatever it is. Obviously, the platform is entirely HIPAA certified. It's pretty industrial grade solution. It's used in much more challenging environments, be it for firefighters or even military use. So here, just an EMS looking in the ambulance and saying, okay, what kind of assistance do I need here? And remember, it's not just like what assistance the physician can provide in terms of on-scene care. It's how do we increase the efficiency of the ICU, the triage process. How do we allocate resources for when that patient's going to arrive? So it's well within the entirety of the RespondEye ecosystem to just improve the communication and efficiency of everyone involved in the operation. Here you can see, and again, it's obviously not this laggy in real life. This is just a YouTube video, but the ability to annotate, to highlight certain features of the patient and say, okay, this specific spot or this specific wound or issue needs particular care. And then you'd have a physician in the background who, again, is seeing just right through the eyes of the first responder.
Thank you so much, Jonathan. And as you can see, that was some real-world footage, actually, of RespondEye being used by a global partner currently. And thank you so much, Chief Egan, for the explanation, your insight, obviously, with the challenges and your assistance in being able to make RespondEye what it is today and tailored to you guys specifically.
Thank you. Appreciate that, bud.
Thank you, sir. Tim, if we, yes. And then let's go back to the benefits. We spoke a little bit about 5G. I mentioned 5G before. Jonathan just spoke about the HIPAA compliance side, obviously making sure that the data was secure, how it was going to be stored. So everything was developed around being compliant with the help of your, on the Crozer side, with ThirdEye as well on our side. One thing I want to emphasize is the RespondEye platform is a cross-platform. It's got functionality across, so you could use it on tablets, you can use it on cell phones, iPhones, Android devices. So it's a great way to get started, before getting onto the glasses or vice versa. So it is cross-functional, guys. Another thing is 5G connectivity. What are we doing here? We've deployed several 5G routers here that are tethering to each headset. So while the paramedic is in the integration phase going out, each headset will have its own dedicated 5G router. With extreme benefits, obviously with protection of that data, only accessible by Chief Egan and on the Crozer side. And then, just to talk a little bit about, Jonathan mentioned the patient saving side. Jonathan, if you want to speak a little bit more on that. But let's first go to Chief Egan now. And Chief, what have you seen in terms of connectivity? Anything different that you've seen using 5G routers?
Only that it's been very clear, concise, no issues whatsoever with the connectivity, and we've had no problems with being able to go back and forth with the hospital and with our other devices that we've been testing this with. Also, from our standpoint too, the glasses can be used for loading our EMS protocols in there if a client or somebody like us would think that is would be beneficial to EMS providers in the field, and definitely the easy recall of every event. So everything has to be recorded, especially when you get into a patient scenario with a medical command physician. we're legally and we're liable to have that information on easy recall, and ThirdEye was able to do that without any problems.
Thank you so much, Chief Egan.
Yep.
And Jonathan, on your side, on the EMS patient savings side, I know you spoke a little bit about, not to get too much into it here, but where do you see this as a benefit to any teams that are interested in trying out RespondEye?
Cool. Thank you, Ari. So there are two things that really are sort of paramount to discuss here. And they're just sort of inevitable facts you have to address when working with any firm, be it a hospital or a traditional real world firm, business or otherwise. So you don't want to put conflicting economic incentives on either side. Hospitals generate money from people going to emergency rooms. That's a pretty well-known fact. It's a significant revenue stream for hospitals. And you don't want to give them a solution, even though it may add the ability for better patient care, which that's simply undeniable. You don't want to do something that maybe your chief medical officer, but your chief business officer disagree with, because it's like, okay, look, but this is cutting into our bottom line. Sure, it provides better patient care, but the reality is that's just not how it works in the real world. So we built this from the ground up. There's a very, very well done study. It's called the Ethan Project. It was started back in 2015, and it ran all through 2018 with Houston EMS. And basically they said, I wonder if we put telehealth, just even in its simplest form, in a small fraction of all of our EMS operations, I wonder what benefits we'll get from it in terms of revenue, in terms of increased patient care, et cetera. And so what they found is just even using an iPad for telehealth with some type of remote physician, even if the functionality wasn't sophisticated, even if it wasn't hands-free, they found that ambulances on average got back in the field 54 minutes on average than when they did not implement telehealth. So this is kind of an important factor going forward, because in terms of ambulances and hospitals and revenue, the revenue model for outpatients is fixed, and an increasing percentage usually rely on Medicare and Medicaid, but the majority, the bulk of the revenue that ICUs generate is from inpatient care. So just talking with Chief Egan and the team and others, it's really how do you allow EMS to see everyone that actually needs to be admitted to the hospital. Not to use the phrase weed out, so to speak, but weed out in an ethical way. It's like, okay, we can provide quick patient care here, and this is going to be reimbursable through telehealth, by the way, which was not the case 3 years ago. So it didn't really make this a viable economic solution, even at the time that the Ethan Project was going on. So the Ethan Project ultimately found that even though they implemented telehealth in only, I believe, 2% of all of their initiatives, that they saved and actually gained 1.77 million in revenue, just even in 2018 alone. So in terms of being a cost saver to the patients, yeah, absolutely. EMS show up, they assess the scene, remote assistance from an expert, and they say, okay, this is probably your best route of next care. You might not have to go to the emergency room. You might not have to pay this bill. That's fine, which again would be Medicare, Medicaid anyway for the most part. So you're not losing money on those people, but you are increasing the number of people who actually go to the emergency room who need it. So cost effective for the people who don't need the ICU. And there's an economic incentive for hospitals and ambulance groups, because ultimately it increases their revenue because they get to see more patients.
Thank you so much, Jonathan. I want to, before we move on to the next slide, I just wanted to mention, Eve and Chief, please, just want to invite you here, is in many cases, a lot of these guys are working long hours, working very hard to make sure they get the patients in a timely manner. And those vehicles are going out. Those vehicles are going, and please correct me here if I'm wrong, Chief Egan, they're going out to service the community. And in many times, those visits may not be accounted for once they get to point A. Chief Egan, can we talk just very briefly on this, how, RespondEye will benefit in terms of metrics and showing those visits and that travel, that should be accounted for, essentially, right? When bringing patients back and forth.
I had a hard time hearing you, Ari. Could you say that one more time?
No, I just wanted not to go too into the details here, but just wanted to mention many times, in just going back to also with Jonathan, the paramedics are going out, they're servicing the community, they're showing up sometimes at calls where a patient may refuse to get in the vehicle. RespondEye, and please correct me, with metrics and the analytics on the backside, will be able to show that those vehicles are indeed going out providing services to the community, and being able to track those services and say, hey, we're providing service out there, et cetera, with use of this platform.
Yeah. Oh, yeah. Absolutely. You'll be able to track, how many times the ambulance or the paramedic or EMT is going out on into the community, what they're doing, what kind of nature dispatch that they're being dispatched to from the local 911 center, and then, hopefully, it may, then translate into a transport. But if it doesn't, we would hope that we would definitely be using the RespondEye platform to kind of help increase our efficiency and figure out ways to do better to perform better service. So that's what I would say for that.
Thank you so much, Chief. Tim, if we can go to the next slide here. So just to, we've spoken about the benefits of RespondEye, just to talk about, the experience with the RespondEye platform so far during the integration phase. Chief Egan, you spoke a little bit about that. If you can elaborate further, how has your experience been with us, with the ThirdEye team through the integration phase?
It has been fantastic. Again, you've taken our feedback in real time, made changes on the spot, came back, and we have had nothing but success so far. We're going down a great path, and I have no doubt in my mind that this will be a very successful venture. And in no time at all, this will become the preferred method to have a conversation with the medical command physician and let him or her give some direction to the paramedics on scene, and most especially on challenging calls. So it's going to happen, and we've seen it in its infancy stages, and we'll see it flourish over the next couple of weeks to months.
Thank you so much, Chief. We, as we go on to the next, I want to tell the audience here, feel free to leave any questions for our panel. Lower left-hand side, you will see that first icon to enter any questions you'd like us to answer here at the end of the webinar. And then going back here, just to, again, short and long-term benefits of RespondEye. As some of you have seen, I was holding up the X2 earlier. This is a thermo camera that attaches to this specific headset. That's been a huge plus with COVID. When COVID initially happened, I know, Chief, you guys were getting calls here not too long ago, where you guys were running in and out with the exposure. Obviously, that it's affected everybody. But we were able to, we're rolling out the thermal camera attaching to the X2. If you can just, short and long-term benefits, Chief Egan, that you see, you probably already spoke about this, but just to reiterate here.
Yeah, sure. Our short-term goals were basically to enhance our communication with the physicians back in the emergency room. We've met that objective, and we are expanding upon it every single day. Long-range goals for us would be to integrate the RespondEye platform and the glasses into a community paramedic-based program, and definitely, hopefully, in the future, a great relationship and integration with our local 911 center, law enforcement, and fire department mutual aid responders. So there are short and long range goals.
We have a call coming in now. Sorry for the noise here, guys, in the background, or not the noise, for the daily grind here that happens at Crozer. We'll just let this call pass through.
There you go. You're clear.
Thank you, sir. And we knew that might happen. It's happening throughout the day. Not everyone can do this job. I've learned this here, being able to work with you directly. It's not for everybody. So thank you so much, for the first responders, the guys that are working the long hours, transporting people back and forth, our patients in our community. I got to see firsthand, not in a television screen, exactly what it is, what it takes, and the efforts that are being put on your side, managing these, leadership on your side. Everyone's on go here. So thank you for having me here with this opportunity.
Absolutely. My pleasure.
Thank you, sir. And we can open up. Let's go to the next slide here, Tim. Thank you so much. So I want to open this up here for our audience. A lot of us, again, that have joined us, Beijing, Brazil. We've got Florida. We've got people from all over. Thank you so much for joining us. Feel free, any questions from your side here for Chief Egan, I see we have one question. Can RespondEye, be deployed to 100 plus EMTs? This is actually a question for Jonathan. And how easy is it to integrate, with hospitals or ambulance systems from what you see?
It's pretty fast. So depending on the hospital, obviously there are some standards across in terms of data storage, data privacy, and I believe Noah can speak more to that. And from an integration standpoint, it's quite easy. We've made it cross-platform. It's a simple web browser that you can either open up on a desktop or you can stream directly to a physician in the ICU from a phone or laptop. So it's designed to be something that's modular and that integrates quickly. You can't expect Chief Egan, those who work for him, or physicians to, just to be able to sit in front of a screen. So they have to be able to give input on the go. And hospitals are always busy. So just really from a value add perspective, it's something that has to be efficient in setting up and maintaining with the hospital. So we've done a pretty good job refining that, and it's definitely a streamlined solution.
Thank you so much, Jonathan. We have another question from another channel of ours here. Steve is asking, this is for Chief Egan, how do you see this being deployed? Is this something that, can be integrated for future EMT paramedics down the road?
Oh, absolutely. Yeah, it's definitely going to be, all of our providers will be integrated into this eventually. So I definitely see how this, the glasses and the RespondEye platform will be, assigned to our units, and it'll be, the preferred method to communicate back to the hospital. So I absolutely see it going across my department and then growing in popularity as we're able to perform this function. Other hospitals and services are going to want to have the same.
Thank you so much, Chief Egan. So I just want to thank, let's see if we have any other questions here. I've got a question from Kyle. Thank you so much, Kyle, for your question. This is for Chief Egan. What is the workflow like for your EMS teams? Keeping it on the ambulance, grab when it's needed. How often are they grabbing it to use the headset? This is a great question, Kyle. This is for Chief Egan.
Yep, Kyle, good question. We're mainly utilizing this platform to have a discussion with a doctor. So in my area, we would notify the hospital of an impending patient of our arrival. We either have a nurse line or a doctor line, and if we're just kind of making a reservation or a notification that we're en route to the hospital, we'll notify the nurse. This platform and the ThirdEye, the platform and the glasses basically are going to be used to talk to a physician only. So it's not going to be used on every single patient, but it'll probably be used, I'll say, on about maybe 40% of our transports, and then basically as far as the workflow goes, our intent is to leave the glasses inside the ambulance, and then once we bring the patient in the ambulance, that's usually when notification to a hospital would occur, and we're able to maybe put the glasses on at that point and have that discussion with the doctor. That's going to be the rollout over the next couple of weeks for us. So I hope that answers your question, Kyle.
Thank you so much, Chief Egan. We have another question here from Niels Martin. Question for you, Chief, is can you speak to the comfort of the users and what the camera quality is like? Can a provider really see a procedure being done remotely? Is there remote camera controls to zoom in and out, for example?
Good question. I'm not sure about the Zoom feature that you're talking about. I don't believe there is, but you guys can be able to maybe talk a little bit more about that, Ari. But I could tell you that they are comfortable. There are different sizes because we have some of my paramedics or the supervisors. We needed the larger headset. We quickly found that out. So they are comfortable. There's no issues, no problems. You can see them in the sunlight or in the back of an ambulance with no issue, and you can hear well with it. The volume, no issues there. So all positive on our end, and just not quite sure about the Zoom. I don't think anybody thought about that. So
I'll invite actually our CEO Nick to talk about the Zoom feature for RespondEye. Nick?
Sorry, could you repeat that? I missed that.
Sure. Just any Zoom features on RespondEye. I can answer this question, or you can, sir, on your side.
Yeah, I think we do have a zoom in feature. We're constantly adding new features based on the feedback we get from the first responders. I think we have John, Ari, you guys working closely with the Chief Egan, and our team works really closely, and we want to listen to the user's feedback. That's what matters to us, is not to develop an application in a vacuum, but develop an application that is really useful and helpful. And any features, we've been getting a constant flow of new features to add to our platform. Like we added a feature where you can track the user's patient's location while using the app, and we're always innovating like that. So I think this is something that we will have that type of relationship with Crozer.
Yeah, Niels, just to speak that a little bit more, anything that you can see inside of glasses, like sunglasses or whatever, like you have the whole scope of your view. That's what you can do inside of these glasses in terms of zoom functionality. The camera's high def. You can add that functionality pretty easily without having to replace the existing hardware. And any size screen you want to put in your view, whatever it is you want to display, multiple screens, etc., that can all be done with the technology.
Thank you so much, Neil, for your question. I think this has been an amazing webinar here. I want to again thank Chief Egan for your time, for the efforts being provided to us here with your team, the hospitality we've received in joining you here. It's been the best experience in my personal career. I've got a few people here in the comments clapping. They're celebrating the webinar. Awesome job, team, with the webinar. Any last words for us, Chief Bruce Egan, that you would like to share? Neil says, thanks, looking forward to further evaluation. Thank you so much, Neil. I want to just leave it to you, Chief Bruce Egan, any last words you would like to share with us, with the audience here today?
Sure. I just want to say that when I first initially heard about this concept, of course, like everybody, I was intrigued. I was a little, wasn't sure about it, but the more I got to learn about it and to work with ThirdEye, there's no doubt in my mind that we're on the verge of something really special, and it's going to make a difference in how we deliver EMS. And I have no doubt in my mind that it will have a sincere impact on patients, and it's going to help save lives. And that's why we're here. That's why I do this job for over 25 years. That's why my whole team's here, and that's why we have hundreds, if not, I should say thousands of emergency responders, EMTs, paramedics, law enforcement, firefighters, all in the same boat, all doing this each and every day. Partnering with ThirdEye is a beautiful thing, and we'll continue to develop it and make it the best that it can be.
Thank you so much, Chief. Thank you so much for your time today and all of your insight. Michael is Michael on the comment side here, cyber screen. Congratulations on an excellent presentation. Well done. Thank you so much, Michael. Thank you for our special guest, Chief Egan, for joining us today. We know your schedule's hectic on your side, and we want to thank you so much for your time. Thank you to our other speakers as well, Jonathan, Nick on here, as well as the rest of the support team.
Yes, and all this will be recorded and saved for anyone to view in the future. But thank you also all the attendees, and we're happy to see the good response, and we want to keep this going and hopefully change the world with it. So that's our goal.
Thank you so much, everyone. Have a beautiful day. Stay safe. And thank you, everyone, for joining us today.